Welcome, everyone. Thank you. Oh, there we go. Thank you for joining us for today's conversation. We encourage you to follow us on social media. On YouTube, subscribe to our channel at Grade Level Reading, where you can access all of our previous webinars that we've hosted. On LinkedIn, Facebook, and Instagram, follow us at Campaign for GLR, and on X, follow us at Reading by Third. Please use the hashtag Learning Tuesdays and tag us to share anything you learned from today's webinar, and we will be sure to repost. We encourage you to share any questions, reflections, and observations on social media. Once again, welcome to today's webinar. My name is Sierra Sanchez, and I will be behind the scenes helping to produce today's conversation. Before we jump in, I want to take a moment to acknowledge our enterprise and programmatic funders, as well as our individual donors. Your support not only allows us to hold these vital conversations, but also helps us create meaningful opportunities to share insights, foster connections, and build the CGLR community. I also want to give special thank you to our Leo sustaining sponsors you can see on the screen here. Thank you for your continued support as we have our weekly learning and engagement opportunities every Tuesday. I also want to take a moment to share a few housekeeping tips with all of you before we jump in. First, we would love for you to introduce yourself, so please use the chat box at the bottom of your screen to share your name, city or state, and your organization. Be sure when responding to select everyone so that we can all see each other's chat messages, and feel free to share your thoughts and insights throughout the duration of the webinar. All attendees are in listen-only mode, but we encourage your engagement by posting questions in the Q&A box. We will dedicate the last portion of the webinar to respond to those questions, and our panelists will be typing out answers as we go through the webinar. The conversation is also being recorded. A link to the recording, as well as all slides, bios, and resources, will be sent in a follow-up email later this week to everyone who registered. And lastly, we will be posting a brief on-screen poll during Q&A and highly encourage you to respond. This helps us with our commitment to continuous improvement. And before we begin, I want to make sure you're aware of some of our upcoming webinars that we have through the end of May and June. Next week on May 26th, we will be taking a short break from our live on Zoom sessions. Instead, we will be having a special rebroadcast on our YouTube channel, so please feel free to subscribe there. We will be rebroadcasting a very special session from earlier this year, Unconstrained Skills and Ecosystems for Learning, an Emerging Conversation, and that will be at our normal time of 3 p.m. Eastern on our YouTube channel. On June 9th, we have an exciting doubleheader back to live sessions, starting with a Crucible of Practice salon at 12:30 Eastern Time with initiatives and lessons from Chattanooga 2.0. And at 3 p.m., we will be continuing our Kindergarten Matters series with Rediscovering Kindergarten, Embracing Play and Joy in Learning. On June 16th, we'll have a funder to funder conversation in support with the William Penn Foundation on funders investing in the teacher pipeline at 12:30. And there are more sessions coming, so we encourage you to keep an eye out for our newsletter with more information and take a look in the chat box for registration links as well. And speaking of exciting things coming, we hope that you will save the date and join us for GLR Week 2026, which will take place from July 27th through the 31st this year. The registration page is officially live, and we will be posting the registration in the chat box, so you can all can make plans and join us from July 27th through the 31st for GLR Week 2026. We hope to see you there. And with that, I am excited to turn things over to Michelle Sayosin-Hyman, who will kick off the conversation and lead us through today.
Thank you, Sierra. So on behalf of the Campaign for Grade Level Reading, welcome. I'm so glad you all can join us today. So at CGLR, our work centers on the conditions that make it possible for every child to read on grade level by the end of third grade. But we know that literacy doesn't begin in a classroom. It begins at birth, in the earliest conversations between a caregiver and a child, in the songs sung at bedtime, in the books read and reread until the pages are worn soft. Our community spans researchers, practitioners, funders, and policymakers who share a commitment to understanding and strengthening all of the conditions across systems and settings that shape a child's path to become a confident, capable reader. And today's conversation sits squarely in that work. We're here to explore one of the most foundational conditions of all, ensuring that children have books of their own, early and often, because what the research is increasingly clear about is that access to books is critical, and yet access alone isn't enough. Ownership matters. The presence of books in a child's life, books they can hold, revisit, and call their own, make a measurable difference in language development, reading motivation, and long-term academic success. Today's conversation is bigger than books in the home, as important as that is. We're going to look across the full arc of early childhood, from birth through the early school years, and across the multiple systems and settings where children spend their time and where books can reach them. We'll hear about books making their way to children through healthcare settings, through childcare classrooms and community-based programs, and through schools. We'll also talk about what it means to not just put books in children's hands, but to equip the families and caregivers around them with the resources and confidence to use those books, to build those reading routines and relationships that turn a book into a literacy and bonding experience. This is systems level thinking about a deceptively simple intervention, and it takes funders, practitioners, and researchers willing to work across those systems to make it real. Before we dive into our panel discussions, I want to introduce the researcher who will ground us in the evidence. Dr. Molly Ness is also an author, literacy specialist, and the CEO and founder of Dirigo Literacy. Her work on book deserts has helped bring urgency and clarity to this issue, and I can think of no better person to set the stage for today's conversation. Molly's bio and the bio of all panelists will be linked in the chat. Molly, take it away.
Well, thank you so much. And I'm so grateful to be here to talk about an issue that I stumbled into when I was a university professor. I have long been a literacy advocate, a teacher, a teacher educator, but it wasn't until right a year or so before the pandemic that I became aware of book access as an issue. It was just something I'd never really considered. So go ahead. I'm going to start to share the research around book access, and there should be a follow-up research guide for you that summarizes some of the studies that I am citing from. So as a university professor, I stumbled upon some of the research that I'm about to share and felt very strongly that more people needed to be aware of this. And rather than write in academic journals, which don't necessarily make their way into the hands of many, I created this podcast and Book Deserts to raise awareness and to shine the light on people who are doing book advocacy and literacy work in really meaningful, thoughtful, engaging, practical ways, some of whom we will hear from later today. So let me first give the overarching research around book access, starting with probably this milestone study from Dr. Susan Newman. It's hard to have conversations about book access without Susan Newman, a professor at New York University, because she was really the person who coined the term and really started to bring the issue to light. So what you're seeing here is a study that took place during summer months. Susan and her graduate students tried to emulate what it would be like for children in different types of communities to access books when their school libraries were closed. So they literally pounded the pavements of neighborhoods in high-income areas and in low-income areas in three different cities. So they took a city and they looked at a high-income neighborhood and they looked at a low-income neighborhood, and what they found was staggering. So remember, books are shuttered in school libraries now because kids are on summer break. So what they did was they walked through neighborhoods to basically see how readily available books were to children. Go ahead and advance, please. And what she found was this staggering statistic. In Washington, D.C., they looked at two neighborhoods. They looked at Capitol Hill, obviously a upper middle class area, and then they looked at Anacostia across the river on the Lower East Side of the city, and found that if you were a child looking to get books outside of your school library, it was a dire circumstance. Let's actually go ahead and look at the next statistic so you can see the stark differences in cities. DC, Detroit, and LA, just two different neighborhoods. The vast majority of the books that they found in low-income neighborhoods were actually not particularly high-quality, literacy-rich neighborhoods. They were very often coloring books. And so this research article started many others about the impact of access to books and why books are so necessary, which is where I will continue to go next. Go ahead and advance, please. Look at this staggering statistic from Anacostia in DC. Again, this is 2019. I hope that things have changed because of the work of some of us on the panel and some of you in the audience today, but this is the first study. I don't know any studies yet that explore access to books in rural neighborhoods. So if we have a doctoral student out there who's interested, this is a gap we need to know more about the access in rural communities, which present even more challenges in some ways. Go ahead and advance, please. This statistic was really one of the big segues into many people's work around book access. And many people just aren't aware that book access is as pressing of an issue. It shouldn't be for many reasons. We're talking about something that is easily transportable, literally and figuratively, no shelf life. It doesn't have to be attached to human capital. So, something that is very accessible, but yet not really there. And we do know, go ahead and advance, please, that the statistics for our low-income children are even bleaker. When we look at data collected from the National Assessment of Educational Progress, we see this staggering feature. Go ahead and advance. Written about by Jarrett Lerner, children's book author and advocate, that it's estimated that about 32 million children lack access to books in their homes, schools, and communities. And I want to share out the work of Unite for Literacy. Go ahead and forward, please. If you're not familiar yet with Unite for Literacy, they have this interactive book desert map, which you can actually zoom in at a very micro level to see your neighborhood, your community, and what is happening with regard to book access. This is data that are compiled from students responding about the number of books in their homes on the NAEP scores. Obviously, the more saturated the color, the dire the circumstance. And if we were to overlay this map with maps of things like poverty, obviously there's a pretty strong correlation between these pockets of colors that we're seeing. Advance, please. It was this work that really got the attention around book deserts. And the International Literacy Association, I'm proud to have served on the board of that for 3 years, has defined book deserts in their literacy glossary as under-resourced and underserved areas and homes with little to no access to written materials. And I want to point out not just under-resourced, but underserved, because when we talk about book access, we can't overlook the populations of students who may not have access to books and literacy-related materials because of situations other than poverty. For example, there are programs that are working to bring books to children whose parents are incarcerated or employed, because if your parent is away, you are likely to miss bedtime stories. And so there are amazing organizations that are serving those populations. So it's not just an issue of poverty, it's also an issue of other factors that we can't overlook. Now, why does access to books matter? We'll dig into that research with this next slide, showing that access to libraries and access to books actually impacts a child's educational level more than the educational level of their parents. We're starting to get really clear data measuring the impact of children's book access and measuring what happens when we get books to kids. So I'm excited to share some of that incoming data at the end of my time now. But go ahead and advance, please. We know that one of the key things that we can do to get children ready to read and send them off to pre-K and K ready to learn is storybook reading and engaging in literacy-rich activities. And books with homes with books, I should say, in them, children are more likely to have that verbal exchange of language, that ping pong of oral language, which is the foundation for literacy, when they are given books. Go ahead and let's look at this next staggering statistic that shows the difference of children who are read about 5 books a day. If you are working with young children or a parent or a grandparent, you know that children, once they read one book, they want more. And we can start to see the vast discrepancies between oral language and vocabulary exposure just from children who are read to. So go ahead and show this next statistic that shows the difference of how many words kids are exposed to by the books that they hear at home. And so this is work that is contributing to the word gap. We can then tease out those word gaps as impacting students' third grade literacy rates, their high school reading levels, their college achievement, because again, that oral language is the foundation of later literacy and is certainly boosted when books are provided to children at home. Go ahead and advance, please. We know that children who have books at home are more likely to live in areas called that value what we call scholarly culture, where there is ongoing learning, ongoing conversation. And now I get to share some of the engaging work done by many of the programs of people who are doing the work and some of the people who I get to see in the chat. So go ahead. I like to make the terrible joke from this next slide. From the legendary Dolly Parton. I like to make the terrible joke that she's working much more than 9 to 5 to get books into the hands of children, because we know Dolly's model of children are registered when they are born. They get books by mail delivery for the first 5 years of their lives. And we now can really see some data showing that enrollment in programs like these impacts child caregiver language, it impacts school readiness and literacy attainment. So go ahead and advance so we can start to explore some of those data. And kudos to all of these programs who are doing this hard work. The percentage of children who are read to increases, of course. And then one of the things that so many of us who are literacy advocates are really intentionally trying to measure is not just the number of books that we distribute, but really their impact on student achievement, their impact on literacy behavior and literacy preparedness, which we start to see from some of the data. Go ahead and look at the next slide featuring Reach Out and Read, the idea of parents and families visit their family healthcare provider, their pediatrician, their special training for pediatricians and healthcare providers to have conversations with parents and families about the importance of literacy, as well as to give out books at these well child visits. Well, I would argue that Reach Out and Read, this pediatric society, has some of the most robust data measuring their impact, not just on language involvement and language development, but also on interaction, literacy attitudes. So really great models of measuring their impact. And then finally, I was thrilled this late spring to look at this next study. That was the first study, to my knowledge, go ahead and advance, about the cumulative access to print. This is a randomized trial, which are very difficult to do because essentially you're creating a treatment group and then a control group. And moreover, this was longitudinal work. So this study was conducted, go ahead and I'll show you the methodology a little bit more, a 5-year study with 60 schools. The treatment group were kindergarten through 6th grade students who got about 7 books a year. This is all in Chicago with the work of Bernie's Book Bank. So they got 34 books over a 5-year period versus the treatment group, the control group. I want to be super clear. We did not withhold books from the control group. They got the books, they just got them later. So we never want to sort of create these inequity situations when we're doing research, but look at these findings of this longitudinal work. Higher scores on state literacy tests. We see a big bump in school reading growth, and all for this relatively low cost of $16 per child per year. So I'm thrilled to see that we really have this methodology that can be disseminated, that we are now starting to show that this long-term book distribution work is doing what we instinctually know, but now we've got the data showing its impact on literacy achievement, learning, longitudinal results. And go ahead and do the last couple slides. I want to just show A couple of very exciting things that are happening in the literacy landscape at the national level. For the first time, in my knowledge, we are starting to see Senate and congressional bills talking about earmarking money for early literacy supplies and materials for family. Go ahead and let's look at the next one. This bill, Open Books, Open Doors by Senator Andy Kim of New Jersey, was introduced in early March. I believe it was introduced on the Read Across America Day. Unfortunately, it was kind of lost in headline news because it was a day that there was just a lot of things going on in the world globally. But look at this bill to expand equitable access to age-appropriate literacy materials, programs, and family engagement in reading in under-resourced communities. So intentionally earmarking money for families and caregivers living in these areas that are book deserts, knowing that the work of the people on this call, the work of these literacy advocacy and book donation programs all over the country truly matters and truly impacts not just a family's approach to literacy and their engagement, but children's literacy development. So let's wrap up with these next two slides. Go ahead. We know from this global study, a 2019 study, that having at least one children's book doubles their likelihood of being on track for literacy. And then finally, I want to just share one policy brief that I wrote several years back. I've updated it and revised it with additional resources. Go ahead and share the last slide. Because it has this, you can scan this QR code, and I believe you will also get access to this policy brief that has impacted some of the work of these congressional bills, as well as other callers who are on the panel today and some of our guest speakers. So thank you for your work to end book deserts, and please reach out to me should you want any of the research itself or have additional questions.
Thank you so much, Molly, for sharing this important and compelling data. And as an aside, when I was first mentioning to folks that you would be joining us today, multiple people, and I am not kidding, that multiple people said, Molly is my literacy hero. So on behalf of all of us, thank you for the heroic work that you do and for being here. I don't think anyone can hear that data, 32 million children without books, one book for every 830 children in some of our highest need neighborhoods, and not feel a sense of urgency. What Molly has given us is both a clear picture of the problem and a powerful argument for why this moment calls for intentional, coordinated investment across systems and settings. So now I want to bring that evidence to life through the voices of the funders who heard that case and said yes, who made a deliberate choice to invest in this work. So please help me welcome our first panel, who will share why their organizations have chosen to invest in early book access, ownership, and literacy, and what that investment looks like in practice. Please join me in welcoming Russ Altenberg, Program Director for Education at the Leon Levine Foundation, Mark Krause, the Executive Director of the Clinton County Foundation, Katie Rast, Chief Executive Officer at the Dr. Seuss Foundation, and Yvonne Lynch, President of Bright Horizons Foundation for Children. Their bios and the bios of all panelists will be linked in the chat. So thank you all for being here today. I'd love to start with the why. So why are you investing? So each of you has made this deliberate choice to invest in early book access and ownership. And that choice doesn't happen in a vacuum. So what was the moment or the piece of evidence or the story that made this feel like a priority worth betting on? Russ, can you start us off?
Sure. Thanks, Michelle. For us at the Leon Levine Foundation, everything we do comes back to one main goal, and that's helping underserved Carolinians reach self-sufficiency. We also have a focus on Jewish values as well. We look at our work across education, healthcare, human services, and we're always trying to figure out how to move that needle most effectively. It was the longitudinal data that really made an overwhelming case for, the smartest, most transformational approach that we could take was really to be upstream. We wanted to invest deeply in kids from birth and prenatally as well. We know that, roughly 90% of brain architecture development happens before a child turns 5. And as our team sat with the question, what's the best way to move the needle on, third grade literacy and reading outcomes? our answers kept going like younger. Is it the second grade? No. Can we start in the first grade? Is it kindergarten? And obviously, younger and younger is where we felt that we could have the most impact and really to try to get ahead of the problem rather than play catch up. And that's why, our Book Abundance initiative, it's such a huge priority for us. You'll hear a lot more about the details on it from my colleague, Jillian Small, in a few minutes. The reason we're betting so big on, book ownership, it's not just about sort of teaching a kid how to read. That is really important. But as most of the folks on this call probably know, like books are also this profound vehicle for early relational health as well. And we were really compelled by that research, which, shows that, frequent shared reading between that caregiver and that infant, that child, that does more than just build vocabulary. It does more than, build that phonemic awareness or early literacy skills. We know it's reducing parental stress. It's buffering that kid against ACEs. It's strengthening that cognitive and kind of emotional baseline that we think kids need to thrive. So, our intent in putting books in the hands of kids and to do that early, to do that often, it was about helping to build those daily routines, help to fortify those relationships that we really believe end up changing life trajectories.
Thank you so much, Russ. And thanks for really elevating the importance of early relational health and how shared reading and books really plays a key part in that early relational health. So Katie, does this resonate with your experience or did you come to this from a different direction or different angle?
Yeah, well, thank you for having me here. I'm happy to be on this panel today with all of you. Of course, due to our name, we all can see a connection to early literacy. Of course, it's aligned with the legacy of Dr. Seuss. His love has inspired, or his work has inspired a love of reading for generations of children. So that connection, I think, is obvious. But I think, many of the listeners today will be interested to learn that since 1958, the Dr. Seuss Foundation has granted over $300 million across actually a really wide variety of impact areas. And it's actually been a more recent shift that our organization, led by our board, has made a strategic move to ensure that our investment is really focused on supporting early literacy and early learning in the San Diego region. We know, as I would imagine, does everyone here, that early education and access to literacy supports the entire trajectory of an individual's life. And we all want children to experience the joy of reading and to develop a lifelong love of learning. And we know that in San Diego, like in so many cities that we all work in, there are a lot of disparities, and not all of our kids and all of our families are able to have the access to these opportunities in a way that is equitable. For example, in San Diego, only 35% of third graders who are considered economically disadvantaged are meeting those third grade English language arts achievement levels as compared to their more affluent counterparts, where you see 67% of children meeting those grade level standards. So, as Russ noted, all of these things are not only critical for ensuring that our kids have successful lifelong educational opportunities, but also this is part of a broader look at how social determinants of health play out in our communities, all of the implications of brain development, of engagement with caregivers, and all of these healthy developmental opportunities that are so critical in these first years of life.
Thanks, Katie. So thanks for elevating also the social determinants of health, early brain development. Those are key things that have helped you create the case or build the case for the why. And I also really appreciated how you brought up local data and how local data helped make that decision. So now with Yvonne, I want to pull you into this conversation because your model is a little different For the most part, you're not writing grants in that traditional sense. You're mobilizing employees as volunteers and channeling books through drives and community partnerships. Also, your Growing Readers program actually focuses on providing books in the childcare classroom. So what drew Bright Horizons for Foundation for Children to this work, and how does this entry point connect to what others might be saying?
Yeah, thanks, Michelle. Appreciate the question. I think, Bright Horizons Bright Horizons is probably most well known as being an early care and education company. And for 40 years has been very focused on providing high quality early education. And the Bright Horizons Foundation, as you pointed out, isn't just a traditional grant-making corporate foundation. We mobilize our Bright Horizons employees to create safe environments inside of community agencies. And for the most part, these are homeless shelters or domestic violence shelters in our communities. So you phrased the question, what's the story? So let me tell you the story of how the foundation came to this work. A couple of years ago, when Bright Horizons Chief Academic Officer joined the foundation board, we started talking about how we could lean into the expertise of her team and have more of an impact with our community partners. So Bright Horizons being a specialist in quality early education, of course, it made sense that we would focus on early literacy as the vehicle to drive that desired impact. At the same time, the Bright Horizons Growing Readers program was turning 25 years old. And my colleague Heidi Morrison will talk a little bit about that program in more detail in the next panel. But high level, this is Bright Horizons Literacy Initiative that's designed to help young children to develop a love of reading and language skills. And it also supports families and educators in making reading a part of everyday life, which we've already heard is just so important. So when our team started strategizing about how we would mark the 25th anniversary of the Growing Readers program, we settled on a national book drive that would be organized by our centers nationwide, involve our enrolled parents in the childcare centers, and benefit local community organizations that support children and families. And so, again, it started with access. We wanted to be able to provide for the 25th anniversary, 25,000 books to the children in those communities. And I'm happy to say we blew through that goal. We ended up collecting and redistributing 41,000 books across nonprofit partners all across the country. But in short, when the Bright Horizons Foundation started thinking about deepening our impact and strategizing with the Bright Horizons education team, focusing on literacy was a very natural fit for us because of the space that Bright Horizons operates in. And so it was really about extending the access and love of books beyond our classrooms and into the broader communities.
Thanks, Yvonne. I love how not only did you mobilize the childcare providers or employees, but also the parents as well. So that's really amazing how you're able to really show that partnership amongst the parents and the child caregivers. So what I'm hearing across all of you is really the shared conviction that books matter. And I really want to elevate something that Molly also raised earlier, which is that distinction between access and ownership. So a child who can visit a library has access, but a child who has books on a shelf at the home, books that are theirs to keep, has something different. So does this shape how you're thinking about your funding or supporting? Mark, what's your take on that?
Well, first of all, I'm more than honored to be on this panel with all these folks. I feel like I'm the odd person out on this one, but so I've been in this role since last August. I've spent 36 years in the nonprofit arena, mostly with youth organizations, and saw, in a lot of cases where kids struggled. When I came into this role, it was astonishing to me to hear the numbers that in Clinton County is a lot of small communities. Wilmington is probably our biggest town, but a lot of small communities in 4 school districts, and only 10% of the kids in Clinton County are kindergarten ready. That number just blew me away. We have a very, very strong Dolly Parton's Imagination Library here. 71% of the kids are registered. But what we're also finding is that although the books are in the home, which is great, we have a generational literacy issue in Clinton County. So even though the books are in the home, are the parents able to read the books to the kids? So, one of the things that, and talking to the superintendents, because you hear everybody say, well, we have a problem, we know we have a problem, but nobody was really doing anything to really address the problem. I asked the superintendents what they thought about getting a group together and start talking about solutions. And that group has now grown to over 35 organizations within the county that are involved, including the superintendents, the college presidents, the nonprofits that deal in early childhood education, the health department, you name it, everybody's on board. And what we're really finding is we're attacking the issue of early childhood literacy, but also adult literacy, because we find that that's a bigger, just as big of a problem. So for us, it's not a matter of getting books in the hands of the kids, because we're able to do that. We also have a great program here with Kids Read Now. I just went on their national board this past year, and based in Troy, Ohio, just a little bit north of Clinton County. And we can get the books in the hands. What we're finding is the bigger issue is, are they actually reading the books that they have at home? And so we're looking at, do we need to address family times where families come into, whether it's the schools or the libraries or whatever it is, and actually have folks there that can read. We had a meeting yesterday with Wilmington College, based here, obviously, and they are talking about for next summer actually having their education majors actually work for the foundation as interns and go into the schools or go into the libraries during the summertime and actually do reading programs to make sure that the kids are actually, the books that they can bring or the books that we can provide, that they can actually get a chance to actually read those. So a little bit different take on the book ownership. I mean, obviously, my kids were very fortunate. We always had books in the home and we read books every night. And I know that's, the more I dive into my job here, I find that that's obviously not the case. But our library systems here are phenomenal, and they do a lot of reading programs. But again, it's not owning the book. It's not able to pick that book up every night and read it. And we all know when we have kids that sometimes you read the same book for a month at bedtime, right? So there's that consistency factor too, I think. So probably Michelle went off course with you, but sometimes I have, it's just wanted to get that point out about, the bigger issue. I mean, it really is at least here in Clinton County, it's a huge issue for us. So.
You didn't go off course, Mark. I think it's really important to elevate your two-generation approach and how working with the parents and the children and the adults. And then I love your how you really took a community aspect and how you have the whole community involved, from superintendents to the college presidents. Really, really important. It's a really good example to elevate. So Katie, I know you also have a history. Dr. Seuss, you mentioned, already has a long history in this space. Anything you want to add or share?
Yeah, I'll just share a little bit about some of the activities we've been involved in recently, just to sort of illustrate some of the work that we're doing. So last year, in partnership with Dr. Seuss Enterprises, we were able to support the distribution of over 47,000 books in the region, working with the American Academy of Pediatrics and First Five San Diego. And of course, we are extremely proud of that work, and so proud of our partners that are helping make that work happen on the ground. Since 2020, Dr. Seuss Foundation has invested over 13 million in the local community through grants directly to nonprofit organizations. The majority of that funding has supported organizations that provide services focused on expanding access to early learning opportunities for children and families. We've also worked in partnership with San Diego Foundation, which is our local community foundation, to align philanthropic investment. We know that we are stronger together, and that in San Diego, as in many places, our region will benefit from a greater investment in early learning. And Dr. Seuss Foundation established a $15 million endowment at San Diego Foundation to support ongoing alignment and investment in early literacy through a program called Ready to Learn, which was launched through a partnership between our two organizations. The book distribution efforts that we support in San Diego focus on both book access, making sure children and families have access to books, and providing services to support engagement with those books. So, and we also look at a variety of spaces, places, and ways that we're going to ensure that access and that connection happens. One example of that would be some of the work with our local American Academy of Pediatrics chapter, where these books are distributed to children during doctor's visits. We've heard from some of the participants who've shared that their children look forward to checkups, which makes us very happy because it's an opportunity to receive a new book, which is just beautiful. First Five provides home visiting programs where a professional home visitor is coming into the home to provide a variety of supportive services for parents and children, but they're also delivering books and making sure that those books are there in the home. And then through grant making to nonprofit service providers, again, we're working both with organizations that are focused on access to books as well as access to services. And you'll hear from Allison from Diamond Educational Excellence Partnership, or more easily said, DEEP, which is a local nonprofit that we work with. And she's going to be speaking a little bit about that work later in the panel.
Thanks, Katie. So now I want to shift the conversation just a tiny bit, where we think about, I mean, everyone can relate to this is making the case. So all of you have either had to present to a board or to a leadership team or even to a skeptical colleague about why you want to make these choices in investing in books and book ownership. So Russ, what has landed? What has landed, what evidence has landed, and what has been harder to communicate than you expected? And especially given that the Book Abundance Initiative is really focused more on healthcare settings, which is a unique angle when it comes to early literacy, is there something in particular that resonated with folks when you were building the case?
Well, to be honest, Michelle, our Book Abundance Initiative went through a bunch of iterations over 18 months to get to where it is now. We actually started with like a basic desire to scale Dolly Parton's Imagination Library. But we knew we needed to figure out like a better way to radically improve those enrollment rates for low-income families. And so we were kicking around a bunch of ideas on how to try to address that. Our first thought was to link DPIL enrollment directly to Medicaid and the Medicaid data. And as we talked with a variety of different partners through what those logistics would need to look like, we realized we needed to shift that focus towards finding the best, most logical touch points, find those trusted messengers, and really engage them in connecting with the families directly. And so that's what led us to targeting birthing hospitals. It gave us this perfect, like stacked approach, if you will. Like we could hand over books right there at day zero at the hospital site through the Books at Birth program at Book Harvest. We could at that point try to auto enroll them into Dolly Parton's Imagination Library, so that same family was going to get books every month over the course of those 5 years. Do that on the spot. We wanted to connect those families with Reach Out and Read pediatrician offices for their child well visits down the road, and then we were trying to tie it all together with a texting program to drip out those tips, those nudges along the way. By the way, shout out to Ginger Young and Jeff Quinn, who I know are on this webinar, tremendous leaders, and it's been so incredible to work with their team. So really our whole healthcare approach came down to, combining like a logical enrollment pipeline with these trusted messengers, the nurses in these birthing hospitals. I'll add that the healthcare angle did complicate our research and evaluation plan that we initially wanted to do around this. So specifically, we were trying to track outcomes at an individual level. Every philanthropy wants to know, like, if we commit all these dollars, like, did this help move the needle, whether it's kindergarten readiness assessment or some other metric. And so we're trying to track at an individual level. You can imagine all the, HIPAA and healthcare related complications that came with trying to go at that. Our foundation, we also prefer to target our interventions to low income families, and Books from Birth, DPIL, Reach Out and Read, those are universal programs by design. So that also added some complexity in how we targeted our dollars and framed our argument to our board. But overall, they were compelled by, the idea of this might be some process innovation and sort of the sum of the parts of all of these incredible organizations working together as part of a concentrated, collaborative in target counties could really drive some outsized gains. And that was sort of the theory of impact that our board was compelled by.
That's great. Thanks, Russ. And thanks for lifting up the challenges that came up in terms of looking at that individual evaluation when you're looking at the healthcare settings. So I'm going to go off script. Sorry, panel, but we are almost out of time. And I really do want to make sure everyone's voice is heard on some of these other questions, especially around the question around equity. And so I'm going to open this up to whoever wants to share. But really, how do you think about equity when you are making your investments? And I don't know if Katie, Yvonne, or Mark, if one of you want to start on that.
Go ahead, Katie. I see.
I was just going to tell you to go ahead, Mark. I saw you. I think you had the quick draw on going off mute there.
I just want to say, we as a foundation, we don't really look at, because we obviously have parts of our county that are poorer than others, but we don't really bring that into the equation necessarily when we're looking to fund programming. I wanted to share real quick, we as a foundation, through our various scholarship funds that we have set up by donors, this year we gave away over $273,000 in scholarships. And I went and I was a presenter at every one of the high schools for senior night. But what's really interesting is there's a pattern. When I said 10% of the kids are kindergarten ready, that same 10% number doesn't change for how many kids graduate high school and go to college. So when I'm sitting in those presentations, 12 to 15 kids got every scholarship that was out there, which was mind-boggling to me, because you have all this access to these opportunities for the kids, and whether they're just not taking advantage of them, whether they don't think they're going to qualify, whatever it is. But it's kind of sad to really watch a room of 150 seniors, and they're all sitting there on their hands while a handful of them, get all the money to go to school. And we do technical degrees and all those things too. So it's just not 4-year, and it's really a sad. It's you love going to the event, but it's kind of sad to watch actually when you sit back and look at the overall view of it.
Yeah.
Thanks, Mark. Katie, Yvonne, maybe Katie, we'll start with you.
Sure. I'll jump in. So, I shared that stat earlier, right? Noting that in San Diego County, we're seeing, nearly twice as many third graders achieving third grade level reading scores. If we look at those who are in, higher income brackets versus their counterparts who are in lower income brackets. And that, of course, is something that is not acceptable within our community. We want to be sure that we are pushing toward a reality where all children have access, and lowering the barriers to that access to all of these services that really do equate to access to opportunity lifelong, right? So in thinking about that, we do have to integrate that into the way that we think about our grant making. And so in our, for example, we just closed out an open RFP that resulted in $2 million in grants through our Bright Futures and Ready to Learn grant making programs. And the criteria that is built in to a lot of the language in the application process does speak to explaining how you're ensuring equitable service provision, and how we're making sure that those in our community who might be experiencing higher barriers to accessing those educational opportunities are being served. So that is a very important element of our work and the way that we perform that grant making.
Thanks, Katie. Yvonne, anything you want to add? before we wrap?
I'll just tell you very high level about kind of our approach from an equity standpoint. I would say that with all of our programs, the approach is hyper local. So again, because we're mobilizing our employees to, give back in their own communities, there's built-in cultural context and local knowledge that I think adds to equity. Beyond that, I would say that we also invest in environments. And in fact, our signature program, which is called Bright Spaces, actually creates unique environments that are individually designed to meet the specific needs of the agency where it's created. And that really allows children and families to connect through play and through books. And then finally, I would say that we have long-term partnerships. So we do maintain long-term partnerships with our agency partners. So, after we create these bright spaces or, we do a Brightening Lives activity to benefit them, again, it's those local employees who maintain those partnerships long-term. And I think that is really impactful, again, just in understanding needs as they change, and it allows us collectively to react in real time.
Thanks, Yvonne. And thank you to all four of you, to Mark, Yvonne, Katie, and Russ for this panel. One of the things that I'm really struck with across all of you is how you really are focusing in elevating important issues that go beyond what one might typically think of language development. You really are looking at early brain development, social determinants of health, using local data to inform your decision making. And I think also looking across different systems and settings, non-traditional systems and settings. Katie, I was struck by how you're working with home visiting programs and local programs. And then Mark, you're working across collaborations across the entire community. And Russ, looking at healthcare settings, but not just in one setting, but across pediatric and newborn. So really excited about the work that you're all doing and really appreciate the time that you've taken today. We'll bring you back on for the Q&A. But I just really appreciate you joining us today. And so now I want to turn to the what, because behind every investment is a program, a partnership, and a child with a book in their hands. So now I want to welcome our second panel who will bring this investment to life and show us what it actually looks like on the ground. So please join me in welcoming Jillian Small, Program Officer of Education at the Leanne Levine Foundation, Chandra Youngblood, Education Consultant with RCY Consultants and a former Director of Elementary Education at Battle Creek Public Schools, Heidi Morrison, Senior Director of Education Curriculum and Quality, Bright Horizons, and Allison Ohl, Executive Director of DEEP. So I want to start by grounding us in what does this work actually look like. So each of you is operating in a different setting, and I think that variety is one of the most exciting things about this panel. So Jillian, let's start with you. As Russ mentioned, the Book Abundance Initiative is reaching children through healthcare settings, which I think sometimes surprises people, especially people that haven't been steeped in the space of early literacy. They're like, really? So can you kind of set the scene for that?
Absolutely. Michelle, thank you so much. And everyone, hello. This is just a real honor to be a part of this conversation. So as Russ mentioned earlier, we didn't really necessarily start with the healthcare setting in mind. Transparently, it was something that we kind of backed into, right? And we chose it because we wanted to reach as many low-income children as possible, as early as possible. And so really we found that the healthcare setting was the best and most universal way to do that. So I want everyone to kind of imagine that they are a new parent. If you are a parent currently, think back to those early days when you're still in the hospital. And you're a new parent and you're welcoming your brand new baby at your local hospital. And before you even leave the maternity ward, the nurse that has been with you gives you a beautiful box of brand new books and really talks to you and tells you about how important it is to be reading with your brand new baby starting at birth. That same nurse also maybe scans a QR code or helps you fill out a form to enroll you in two really critical programs. The first is Dolly Parton's library, which I know a lot of us here are big supporters of. So that program helps ensure that your newborn will have books mailed to them every month until they turn 5. That nurse also helps connect you to a text messaging program that actually sends weekly developmentally appropriate evidence-based tips to help support you as a parent know what to do to be able to support your child at home. So before you even leave the hospital, before you even take your baby home, you are set up with a starter library, and you as the parent are really empowered to know that books can be such a powerful tool in building that relationship with your new baby. But really what we designed to do is that those supports don't just stop when you leave the hospital. At your well child visit, so starting at day 3, right? Your pediatrician reinforces those same messages and uses books really as tools for connection. So again, this is we're creating a system where you and your newborn aren't just hearing these messages one time, right? Instead, you're really hearing them consistently, and you're surrounded by these messages really from the earliest years and earliest hours of your child's life. So we wanted to use, again, the healthcare system because this is a way to use trusted messengers, right? And as a way to reach parents and children as early as possible. And that's really the vision of this book, of this world that we are building, where we're building this continuum that leverages universal access points, right? Birthing centers, pediatric centers, right? To ensure that every child has the tools that they need to thrive.
Thanks, Jillian. I love the universality of the approach, and then also using the trusted messenger. So one of the, where I used to work at Silicon Valley Community Foundation, and we did a study that asked parents, who are your most trusted messengers? It was pediatricians and nurses, and it was also their child's teacher. And so I want to switch it over to come to this from a more traditional angle. So Chandra, you're coming to this from the school side. And so while you were at the Battle Creek Public Schools, your schools implemented a program called Kids Read Now that took a really specific approach to book ownership through the school system. Can you tell us more about that, and why did it matter?
Yes, absolutely. Thank you. The thing about what we were trying to do in my district was reduce summer slide, and Kids Read Now came along right at the right time. This was all pre-pandemic, and the beauty of Kids Read Now is choice and the summer mailing. For me, that's the beauty. One, students, before they go home for the summer, they get to choose from a catalog of books at their grade level and interest level, which is important. It's not just here's a book, right? What kind of books do you like? And then there's opportunity for the teacher to introduce new things to them, like, why don't you try this book? I think you would like it. So there's that opportunity. And so they go home at the end of the year with 1 or 2 books, but then every 2 weeks they get a book or a couple of books in their mailbox, right? And so how wonderful is that it is, to me, that really kind of capitalizes on, this is your book ownership, right? And even if there's 2 or 3 kids at a school, at that school that's doing Kids Read Now, everybody gets a package with their books in it. And as Kids Read Now evolved, they started adding questions for parents. They started adding a writing component. And so it's around literacy as a whole, not just reading the books, but comprehension, writing your own books. So that's why I love Kids Read Now. That's why I love the program and our goal, and they are aligned with it, is reducing summer slide. And so, we watch that data. We ask kids when they get back to tell us about their books. If they're in the summer program, they get to bring some of their books from home that they got during the summer to share and read with their friends. So I think that ownership piece and that choice is big.
Thank you, Chandra. I love how you mentioned choice and motivation, and really what that really brings is the joy of reading, right?
Yes.
Back to the children. So thank you for that. So
Mhm.
Allison, I know you make connections to children and families through school, but your work really relies deeply, and that was a pun intended, deep. You work at deep on community partnerships. So can you touch on that and tell us specifically more about the 1,000 Books Before Kinder program?
Yeah, thank you. And similar to what others have shared, I'm just super grateful to be here today and to learn from so many other incredible programs that are happening and to share the great work that we're really proud to do in San Diego. So our Deep does a handful of things to support literacy outcomes, but specifically the 1,000 Books Before Kindergarten program is where we partner with, well, the unit of partnership for Deep is the school. So at the schools where we partner, we work with the UTK or pre-K teacher to get all of the students and families enrolled in our 1,000 Books Before Kindergarten program. We also hire, and I'll talk about that in a second, we also hire trusted messengers from the school community. Sometimes they're moms, sometimes they're school staff. Kind of depends on like who are the people that the most grown-ups are standing around in the parking lot. We offer that person an hourly role on our team to be kind of an ambassador and like a intel collector for our program, so we can really keep our finger on the pulse of what the real needs are of our school community, and also they can share information in ways that are really responsive and receivable by the families that we're trying to contact. So in addition to partnering with the pre-K or UTK teachers, we also have those trusted messengers who we call family empowerment partners, basically chasing families down in the parking lot if they have babies and strollers. And just beginning conversations with them about like, hey, are you reading regularly with your kiddo at home? Why not? And we just begin to learn more about what the various barriers are, and then we just work on chipping away at them. So if it's, there are, lots of different reasons. So I won't get into the weeds of all of them, but it really is this very unsexy, tedious, case by case outreach and approach of really building relationships with families. And once we have them enrolled in the program and then we can be in contact with them regularly, we're able to make progress. And what ends up happening is after a family has read 25 books and we know that they're and the way that they have books to read is we put little free libraries at the school campuses. We do exchange programs of gently used books. And once you've read 25 books, we give you an incentive prize. So the first prize is magnet letters to have on your refrigerator at home, so that you can start talking about the letters with your child. And then after you've read 100 books, we start to build your home library with beautiful brand new hardcover books. And families earn another packet of hardcover books to build their home library every 100 books that they read through the goal of 1,000 books. And that program's in partnership with our public library system. This morning, actually, I got a message from my lead family empowerment partner that we've just wrapped up the data for this year. We had 375 families participate in the 1,000 Books Before Kindergarten program this year across our 4 schools. 57 of those families met the goal of reading 1,000 books before kindergarten. That means that about 300 families read somewhere between 200 and 1,000 books with their kids this year. And really the goal, of course, is to just build that habit at home. And we find that 2 things happen as a result. One is kids who participate in the 1,000 Books Before Kindergarten program outperform their peers who didn't on kindergarten and first grade early literacy assessments. One of the other things that Deep does is work in classrooms K-3 in the schools that we partner with. So we actually have access to that data. The other thing that happens, which is kind of like the secret byproduct, or like our, our secret agenda, is that families show up to kindergarten with a deep sense of their agency as their child's best first teacher, regardless of, or I should say, inclusive of everything about their lived experience. You don't speak English, you don't know how to read in English, you don't have access to books. We will help you figure out how you still get to be your child's best first teacher by having them learn to love sitting in your lap and listening to stories, looking at books, listening to your own stories and making their own little books. There are still ways for you to claim that role. And we just find that once people get a taste of that, especially if it was not part of their cultural experience as children, then we can get out of the way. Then we can just step back and watch what happens next. So I think I've answered the question. That's the general contour of what we do at the 1,000 Books program.
You did. Thank you, Allison. And that's exciting. Over 300 families reading anywhere from 200 to 1,000 books before kindergarten. And not only that, I love how you're really creating, families are having an identity. It's their identity to be their children's first and most powerful teacher. And that is how they recognize themselves. That is so powerful. So we talked about healthcare settings, we talked about school settings, elementary school settings, and so another important setting for our children is childcare. So I want to turn it to Heidi to talk about some of the work that you're doing and really how your Growing Readers program actually builds the libraries within the childcare settings. Can you tell us more about that?
Yeah, absolutely, Michelle. Thanks for having me here. And what I've loved hearing about is that there are so many different perspectives and so many different ways to get books in the hands of children. So it's been great to be part of the panel. But from the childcare perspective, increasing access to high quality books is really very aligned with everything that we've heard so far. But there's one unique and powerful opportunity that we have that we really leverage in these cases. So for many of our young children, birth through probably 5 or 6 years old, early childcare settings like Bright Horizons are where they spend a significant portion of their day, especially their waking hours. And so these environments, these childcare settings for us become really very essential spaces that we can use and leverage to build early language skills and really just a love and a joy of books and of reading, right? It's not just about learning how to read, it's about loving reading itself. So book access for us is very inseparable from high quality teaching and learning about literacy as well. So at Bright Horizons, we have one of the programs we have is called the Growing Readers program. And I know Yvonne mentioned this in the panel that we had before, but it's a key part of this literacy work that we do. So every year we curate a list of high quality children's books, and we send those books to our 600 centers across the country. And the way that we pick books is, obviously those that have rich language and vocabulary, lots of diverse and inclusive representation, so children see themselves as part of those stories or represented in those stories and in those books. Beautiful, strong storytelling themes, lovely images, and in many cases, they're just books that are fun for adults to read to children or for children to read to each other or to kind of look through themselves. And then what we do is we really try to extend the impact to the families as well by showcasing the books that we've selected and offering them ideas for very simple and playful ideas for activities that they as parents can use at home to continue and to extend the learning. Because what a lot of the panelists before have also talked about is this idea that it's not just putting the books in the hands of the children, but really educating the adults that are part of their lives, their teachers, their families, the grandparents, whoever is around them, to get them to kind of extend the learning through these books. And then one of the other things we do is many of our centers have these little checkout libraries where we have them in the lobby or right outside the center. So families themselves can check out books to read with the children at home. And we'll often partner with the authors in the Growing Readers program to bring them in for special events so that they can read to the children and kind of, share this shared love for literacy. And then one of the other things I've been thinking about a lot is that's distinctive about this early childcare setting is the ability to embed literacy and reading throughout the entire day when the children are with us, right? So whether it's through the Growing Readers program or really all books that we find available in our environments and in our centers, reading's not confined to one single moment in the day when, they're sitting down at group time and just teachers reading a book to a group of children, but really it's meant to be woven into all parts of the day. So when they're playing, when they're asking questions, when they're exploring things in the dramatic play area or the STEM area of the classroom. So teachers really are taught to use books to spark conversation, to build vocabulary, to connect to children's lived experiences, which is very critical for our youngest learners. Because we, in fact, are reaching children during a very crucial developmental window in time before formal schooling begins. And so helping to develop these early literacy skills alongside their love of learning and curiosity and connection helps to bridge that gap in access and ownership that might exist outside of the classroom setting.
Thank you so much, Heidi. So a number of you have touched on this about how you're working across different systems or with different collaborators or different partners. Jillian, I just want to come to you as we think about what you're doing and how you really have this true continuum of book access from birth through age 5. And I know there's even a vision to expand beyond that continuum at some point and reaching different systems and settings. Can you talk about what that looks like?
Yeah, of course. I think what's really important to note and what my other panelists have talked about is I think we are each touching or each kind of owning one piece of the overall pie, right? We're owning the early care piece or the school piece. I think where our program is right now is really hyper focused on that healthcare setting, recognizing that for it to be truly impactful, that piece of the pie, to continue the metaphor, needs to connect to all the other pieces, right? So currently, kind of, we are working towards a vision of 5 counties in North Carolina. These are low income counties, excuse me. Russ mentioned earlier in our conversation about how that targetability is something that's really important to our board. We're going to be targeting about 3,000 babies that are born each year across 4 birthing centers, which is very exciting. And again, hoping to kind of follow these children throughout the first 5 years of their life in all of the settings in which they are, seeing doctors or seeing nurses or things along those lines. I do just want to stress that this is while important and while something that is so critical and something I'm personally very excited about, I recognize that this is a piece of a broader puzzle, right? I think the overall vision is that everywhere a child or a family turns, whether it's the grocery store or the laundromat or the dentist office or the early care setting or anything, right, is a abundant world of books, right? And so every single time, and their home, right, where every single time a parent or a caregiver is with their young child, they feel empowered, they are equipped, and they have the tools to be able to use books to really not only build that bond, right? We've said that, earlier in this conversation. But again, as my other colleagues have said, so that way that young child is able to show up on the first day of school and is just set up for lifelong learning.
Jillian. Allison, do you want to share anything else about any unexpected partners or places of connection in the work that you've been doing at DEEP?
Yeah. And Jillian, I just want to hug you. Like so much of what you just said resonated with me so much. And especially this part about how like this is a super necessary, but just it's insufficient on its own, right? Like there's so many pieces, so many things that need to happen in order for a child to learn how to read. And really what we're talking about is when we talk about a child learning how to read, we're talking about a person being able to lead their own life. Like these are the stakes that we're talking about. And so one of the other things that really needs to happen is that kids need to be taught how to read effectively by people who have been trained in how to actually teach kids how to read. And it is not the teacher's fault. Like we have been off base for a long time in our country. So one of the things that we have been doing at DEEP, which has been wildly successful and beyond my dreams, has been partnering with local university, San Diego State, and this coming year, we're starting to partner with high schools. And we are training undergrads in the phonics curriculum that our teachers are using so that they can push into classrooms and to help teachers, because teachers don't have the capacity to meet all of those varied needs in a classroom at one time. So pushing in trained support under the guidance of the teacher to take small groups, that partnership with San Diego State has been amazing, and we're extending it now this year to Mesa College, which is one of our local community colleges. And then we're partnering with a local high school to bring high school reading helpers in, and they're going to match up with kids on a one-to-one basis, just to kind of like create a relationship. Because if you want a little kid to do something, you get a cool teenager to teach them how to do it. So one-on-one, they're getting matched up with 4th and 5th graders that need just fluency and automaticity practice to really bridge from decoding to comprehension. And then those little guys are going to just practice reading aloud to their older reading helpers. So we're piloting that this year with a local high school partner. And what we're excited about with that opportunity is over time, we're going to have the opportunity to shore up the literacy skills of those older kids under the guise of, oh, we need to practice these phonics so that you can know them for your little buddy. But it's actually a way for us to teach you how to fill those foundational gaps in a way that's not humiliating when you're an older learner and you didn't get it when you needed it. So we're super thrilled about just what there is in the world of like other young people around us to help meet a real need with our youngest learners.
I love that. And I actually want to hug all of you. So Allison, you want to hug Jillian. I want to hug all of you. And sadly, this panel, we're running short, but I do want to ask one more question. And Chandra, if you could just start, because I'd love for this to land with the funders in the room, because I think it's the most practical thing we can offer them today. So if you could speak directly to a philanthropic leader who is watching and thinking about where to invest, what is the one thing you wish more funders understood about what it actually takes to get books into children's hands and keep them together?
Absolutely. And this panel has solidified that we know that literacy doesn't start at kindergarten. It doesn't end in June and start up again in September, right? And so based on the research that we got from Dr. Ness at the beginning, we know it, but I always love hearing it again, that the ownership of books, the access to books, and that reducing the summer slide so that they can go on to be successful and be literate and be great community members that can see the sky is the limit. So I just believe that if the funders help these wonderful organizations, schools, everything in their community to help get access and ownership for kids and books, I think that is the number one thing I want them to know.
Thank you. Heidi, anything you want to add? Like 30 seconds?
Yeah, I would just say that, it's a united effort to try and get books into the hands of children. And we're doing this like one book at a time, one child at a time. And we focus a lot on, what do the children need, but we also have to think about what do the adults in their life need as well. And so we've got a ton of resources that we can put in the hands of both teachers and families to help them feel confident, to be able to kind of have a conversation around a book, to create a connection, to introduce vocabulary so that we can get those skills to the children and help them get across the finish line. So thinking about getting the books in the hands of the children, getting the resources to the families and the adults in their lives. And the goal really is to help children see reading, I think, not as an isolated activity, but a consistent and reliable part of their lives that they will have, no matter where they go and what they do later on. So yeah, that's my plug.
I love that, Heidi. How can we make reading a consistent and reliable practice in a child's life? So thank you, Jillian, Heidi, Chandra, and Allison. Unfortunately, this panel, we need to wrap the panel so we can open it up for Q&A. So I'd like to invite everybody onto the Zoom screen. And if our audience could put your questions in the Q&A box, we'll go ahead and start answering some of them. So I'm going to start with one here. And so we've heard about books reaching children through healthcare, schools, and childcare settings. Are there settings or touch points that the field hasn't fully tapped yet? Places where books could reach children that we're not thinking about? So Molly, let's start with you. on that one?
Well, I'm always encouraged by innovative programs that are reaching kids where they are. So, for example, we see book vending machines, and by vending machines, they're actually free to kids outside of WIC centers and playgrounds. I'm super excited by programs that, like United Through Literacy, which has a recording studio on every military base around the world so that parents who are deployed can read a book and then the book and the video go home to that child at home. And I also am really encouraged by people who are being really thoughtful in the way in which they group services. And by that, I mean the Maryland Book Bank sits in the middle of the city in this huge warehouse that brings together a book bank, a school uniform bank, a bank for sports equipment, for diapers, and the idea is if you are a family who needs those resources, you likely don't have the time or the transportation ability to go to 18 different spots. So it's literally one-stop shopping. And I just think that is one of those brilliant ideas.
Great, thanks, Molly. Anyone else want to add anything to that?
I'll just add that at the Bright Horizons Foundation for Children, a lot of our partners are food banks, and they provide books to the kids. And so we do a lot of book drives that actually go to food banks. And so when the kiddos are coming in with the parents to shop for their groceries, the kids leave with a book and it's theirs, which I think is amazing as well, because again, having a book that's their own is just so very important.
Thanks, Yvonne. So I'm going to turn it to a question from the audience, and I don't think we can have a conversation nowadays about books without having the question being raised about screens. So what can any of you talk about your concerns about the possible negative impact of screens and thus even the greater importance of real books? How have you thought about that, Chandra?
I was thinking about it with the first question, but I'm seeing a lot of games and watching cartoons. It's one thing that if you had a book on there, a virtual book, but that's not what I'm seeing. And I'm trying not to be the crazy lady with books in my bag, and everywhere I see somebody in their grocery cart with their kid in their phone, I want to say, take this instead. So I am not an advocate. There is something about touching the page and turning it and enjoying the illustrations for me and even kids that are on screens, when you give them a book and really introduce them to it, they love it.
Well, I have to say, I think it's a combination. It's a happy medium. I look at my daughter has a degree in education, and she has a 7-year-old, and he is coding video games at 7 years old, but he also reads at a 5th grade level, and he's in the 1st grade. So it's a matter of the parent working with the child to make sure that there is limited screen time. But as long as the screen time is positive screen time, I really don't have an issue with it. I think we have a generation coming out that has lost a lot of social skills because of screen time. They don't know how to look people in the eye. They don't know how to do a lot of those things. But I think for the kids in school right now, if we can find that happy medium and still get the books in their hand and have them read, I don't think there's a problem with spending time on the screen.
And I like to make a plug for technology in general, because, I'm thinking about those children who love to have books, same book read to them over and over and over again. And perhaps there's a way to, the first couple of readings are done with an adult as they should be in an engaging conversation. And then perhaps there's a book on tape where the child can sit and read the book quietly while they're flipping the pages and the book's kind of narrated through them. And then I've seen lots of success too with, young children who are starting to learn how to read. And of course, we don't want to take away the actual books from them. We want them to have that access as much as possible, but trying to leverage technology in a way that it helps some of these children to be able to kind of further their literacy skills is always something I think that we would be willing to explore.
Thank you. And there are a number of sessions that we've had around screen time and technology, and really thinking about how the context that you're in. And so keep an eye out on some of our upcoming webinars around technology, enhanced learning and teaching. But it is an important conversation to continue to have around tech. Some of you have seen, you've probably seen there's an engagement poll. Please take a moment to take a look at that and fill it out. But don't end, because we do have one more final lightning round question for everybody. And it's one of my favorite questions. So if everyone in the screen could take maybe about 30 seconds to just share, what's the children's book you'd put in every home in the United States and why? And I'll just call on you in order of my screen. So Molly?
How Rocket Learned to Read by Tad Hills, because it shares the joy of books and learning to read.
Katie?
I love the Lorax and the message that it brings. You know, I had to go with a Dr. Seuss book. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not.
Love the Lorax. Mark?
Mine would probably be Goodnight Moon, but mostly because I read it to my kids every night. That was their favorite book growing up. So I could probably recite that from memory still today. So
Thanks. Jillian?
Mark, you stole my answer, but different reason why. I was also read that book as a child, but I think that book really encapsulates the conversation that we're having today. That book is simple. It is not world changing, right? It is not complicated, but it is a really simple, beautiful way to build reading into your daily life.
Yvonne?
I have to go with one of our growing readers authors, Peter Reynolds, and his book Be You. It's all about helping kids understand that they are who they are and who they are has value. And it's just such a great, important message, giving kids confidence and self-acceptance early on.
Heidi?
I also went with the Growing Readers book. I had to, and I pulled it out because I just reviewed it. I'm sorry you can't see, it's a little bit blurred, but it's called Snail Crossing and it's by Corey Tabor. And I loved it because it was funny and fun, and you could read it with children as young as 2 and as old as, like, I read it with my 7th grader and we had a good laugh about it. So I'm not going to share the surprise secret at the end, but if you haven't read it, I highly recommend it.
Thanks. And Chandra?
I don't know if I'd put it in everyone's home, but I read it to my 3rd and 4th graders as a teacher. It's Stephanie's Ponytail from the 90s by Robert Munsch. It's a silly little book, but it promotes self-confidence and encourages individuality. And it addresses, how to handle peer pressure and bullying and kind of a little bit of everything.
Thank you. And last but not least, Allison.
I love Stella Luna by Janelle Cannon. It's gorgeous, but it's also just the story of how we belong to each other and how we really need to take care of each other. And it's just beautiful.
Oh, thank you. I love that. The message of how we take care of each other. And thank all of you. Thank you all for joining us today for today's webinar. I just want to offer our sincere thanks on behalf of the Campaign for Grade Level Reading to Molly for grounding us so powerfully in the evidence and for being so many of our literacy heroes. I kid you not, there were multiple people who said that. And then to all of our panelists for your generosity, your candor, and your passion that brought to this conversation. And to each of you in the audience for showing up in this work. So what today reminded me is that getting a book into a child's hand seems simple, but it's so profound. And that when we work across systems and settings and sectors to make that possible, we can really change the trajectory of children's lives. So we hope you'll share today's conversation with your networks. You should all be getting a recording and links to all the resources. And help us spread the word about why this work matters. And if you are a funder, we hope today has sparked thinking about how early book access and ownership might find a home in your portfolio. So please join us for an upcoming CGLR Learning Tuesday webinar. You can see them listed up here. And I hope to see you all again soon. Thank you so much.
Nice job, Michelle. Thank you.
Thank you for having us.
Thank you
Thank you all.